There is lots of different medication that can be prescribed or used with IBS, and it very much depends on the type of IBS that you have. For example, some of us can have diarrhea-dominant IBS, which means we're looking at drugs to help to support that. Some people, it can be constipation-dominant IBS, which we then look at a completely different set of medication for. And thirdly, we can have people that have a mixture of both and can require a completely different approach in terms of their medication. There's quite a few things over the counter that you can buy from the pharmacy to use for your IBS, but I think it's very important that you know what type of symptoms you're trying to treat with your IBS and perhaps have a conversation with the pharmacist before you select a product. For example, you could choose an agent which might actually make your set of symptoms worse, so it's quite important to actually have a conversation with somebody before you pick something up. The things that we can buy to help ourselves, we can buy a short course of Antispasmodics over the counter to help with that cramping and pain issue if that's what you've got. Laxatives, again, if you've got constipation-based IBS, might become an important part of your treatment. There's two general areas of these medication, and we prefer to go for more of the bulk forming type when we have IBS. These tend to come in a sachet, which you would mix with water, and they tend to either add fibre or more water properties into your bowel so that your stools are more formed and easier to pass. These mimic the natural rhythm of our bowels, so are better when we need to use something a bit more long-term to control our symptoms. The other type of laxative products that we can buy or be prescribed are tablet versions, which usually just help to stimulate the gut to move a little bit better. We really only like to use these short term because we prefer to go down the more natural rhythm route. So if you are needing something longer term, we will prefer to go for the liquid-based products for you. Timing can be really important in terms of some of our medication. For example, Antispasmodics, following the instructions with the pack and actually taking it sort of 20 minutes before you have your meals really helps your tummy and your bowel to be relaxed for that food coming in, and hopefully counteracts the cramping, the abdominal pain and the bloating that you've been feeling because of that. Timing is also important with laxatives as well. What we tend to find is people can have a bad experience with them and be wary about taking them on a daily basis, which then leads to them becoming constipated. So the approach we would prefer to take is to take as low a dose on a regular basis so that we can keep your bowels from becoming constipated. So whatever laxative product we all decide is the best one for you, it is important to make sure that you're taking it on a regular basis if chronic constipation is part of your condition. If you are taking laxatives, it is very important that you make sure you're drinking plenty of fluids to help those laxatives to absorb more water in your stools and have this nice positive effect of having regular, easy to pass stools. It's quite natural to look at for these kind of solutions when you find out you've got IBS, but it's quite important to speak to your healthcare team about those, because some of them might actually be making some of your symptoms worse as opposed to making them better, and quite a lot of them are very expensive as well. So yeah, they are there, they can be worth a bit of consideration, but I would definitely work with them with conjunction with your dietitian, your GP or a pharmacist, so that you know you're not actually investing in something that might actually make your condition worse. Hopefully with all the other measures that we can help you with your IBS, such as well-being, exercise and hopefully dietary, you might find that your need for medication very much changes as you become able to get a better handle on your IBS and control the symptoms yourself. So quite a lot of people find that moving forward, once they've got the right interventions in place, they don't need to take prescription medication for it or buy things for it. So yeah, it's very important to have that reassessed by your dietitian, your GP or a pharmacist, so that we know you're not taking anything that you don't necessarily need and hopefully don't need moving forward.